Welcome back to Rohrich Knose podcast, helping you become a better and more educated you. So let's talk about Accutane. Now, why is a plastic surgeon talking about Accutane, which is isotretinoin, and it's a very powerful acne drug? Well, I want to talk about how useful it is and how we need to dispel the myths about this powerful acne drug and what implications it has for cosmetic surgery, especially for rhinoplasty. So please give me your comments and thoughts, and I really appreciate you subscribing to my YouTube channel and also to my podcast, because this is a very important thing to learn, because Accutane, as it's called in the United States, or isotretinoin, has really, I think, been maligned somewhat because of some of the myths and actually things that have been said about it, how dangerous it is, especially in wound healing and scarring. Now, it is a very powerful drug, and it needs to be very well controlled. And of course, in the United States, Accutane or isotretinoin is really carefully regulated, and really only dermatologists that actually have special training can actually prescribe it, because it can cause some congenital deformities in women of childbearing age, but also you must monitor their liver function. So you have to work with a dermatologist, and I work with several excellent dermatologists that allow me to prescribe it to my patients in plastic surgery. So why use isotretinoin? Well, obviously, as we know, it's an incredibly powerful drug for treatment of severe acne. And it's really been transformative. And I've seen so many patients that have been on isotretinoin and have just had incredibly bad acne, and it's cleared it in 6 months. But it's a very powerful compound, and it comes in multiple different doses. But this all must be done under the care, at least in North America, of a dermatologist. And that's very important, because there are some incredible side effects, from not only dry eyes, nose, skin, and lips, but also you can have some fatigue, headaches, hair loss, sun damage, sun allergies, changes in vision. But the big thing is birth defects. So you've got to make sure patients are actually on oral contraceptives or not childbearing age, but they also need to be monitored very closely for liver function. So that's very, very powerful. So what did we do? We went and took a deep dive along with a couple of my dermatologic colleagues and from the Mayo Clinic. And basically what we found was that in looking at a systematic review of all of this, the literature on Accutane and its treatment, we found 610 articles, but we screened them down to their indications, especially in surgery and in laser, and found out what's true, what's not. And we really excluded a lot of articles, because what we found is that Accutane acts at the cell cycle level, and its effect on the skin is very powerful in diminishing sebum, and it's very, very powerful in decreasing the ability to, as an anti-inflammatory agent, and also in wound healing. This is the powerful effect, is that it actually diminished collagen formation, reduced collagenesis, and that actually is a very, very powerful thing, especially in patients that have abnormal wound healing or scar formation. So the effect on skin and acne is very powerful because of its effect on the oil producing glands of the skin. But for wound healing, it can be used very, very positively to help you. And so that's what I'm going to focus on. As a plastic surgeon, if you can inhibit normal and keloid fibroblast growth, which is abnormal scar formation, that's very powerful. And that's exactly what Accutane does. And it's an anti-inflammatory agent. It alters the epidermal cell structure and accelerates mast cell accumulation. So what does that mean clinically? It means that it can actually minimize wound healing and minimize scar formation, especially in patients that I see all the time, like a rhinoplasty patient, like this beautiful woman that had multiple different rhinoplasties, and she had really significant bulbosity of her tip, all due to scar. And then placing her on a low dose of Accutane really was remarkable over 6 months to give her shape and definition, which you could never get by just allowing it to heal alone or even with Kenalog steroid injections. This shaping really was remarkable in patients like this. And I now treat patients for 4 to 6 weeks preoperatively with low dose Accutane, 20 milligrams, 20 to 30 milligrams, and then for 3 to 6 months post-surgery in patients that have a history of significant scarring and wound healing abnormalities after rhinoplasty. Now, I don't use it in all patients, but in select patients that have had that history. And it's been dramatic in these patients. So I think that's very, very powerful. So I would say the most important myth to dispel is that Accutane can be used as a very powerful influence as a wound healing modulator in plastic surgery. I use it in rhinoplasty. Probably can be used in enhancing or decreasing scar formation in breast surgery as well. But in revision rhinoplasty and in patients with thick skin and males, I found it to be very, very powerful. And so focusing on the positive part of it, and also in the dermatologic literature, in the past, people were told that you shouldn't do skin resurfacing or chemical peels for a year, and now it's been reduced to 6 months or less, and some people are even doing it far earlier, but I still do it at 3 to 6 months. I wait to do deep resurfacing because of the problem with potential scar formation. So it's a very powerful drug. Know the science, know before you go, be educated, and then work with your plastic surgeon and especially your dermatologist when you have these wound healing issues, and you can really, really go a long way to managing patients like this that have significant scar tissue formation, especially in revision rhinoplasty patients, which are really the most challenging patients in all of cosmetic plastic surgery. So please give me your thoughts, give me your comments, and know before you go. And until next time, stay smart and stay educated.